Critical thinking is a type of thinking known involving asking, analyzing, interpreting, evaluating, and making a decision about what you read, hear, say, or write. Um, the term critical comes from the Greek word kritikos, meaning able to judge or discern. By making a reliable judgment based on a piece of reliable information, we can call it as good critical thinking. Applying critical thinking does not mean being negative or focusing faults. It means being able to clarify your thinking so that you can break down a problem or a piece of information, interpret it, and use that interpretation to arrive at an informed decision or judgment. It is essential to have critical thinking while working in a healthcare department. Why? Because critical thinking promotes or encourages our curiosity to know more about certain something. It makes us raise questions and explore what's unclear or unknown. This is very important for students who will be involved in the healthcare department. Because curiosity will make us tend to do more research and ask questions to solve certain problems or just to add new information in mind regarding the daily healthcare news or research. So when it is time, they already have the knowledge that can be applied. Also, curiosity makes the students remember better all the answers they get, because when you are interested in something, you tend to remember it better. And as a soon-to-be healthcare workers, we need to remember all the basics and the answer to certain problems. So, to sum it up, critical thinking will encourage curiosity that can make the student an up-to-date health worker when their working stage begins.
The second claim that showcases the importance of critical thinking in the healthcare system is the ability to make a conclusion or judgment based on the scenarios in our surroundings. Critical thinking has taught us on inductive and deductive reasoning, in which inductive reasoning is the ability to make a general conclusion based on the data collected, while deductive reasoning allows us to make a specific conclusion after analyzing the data. These skills benefit us as a healthcare practitioner in making judgments, especially for diagnosis or drug dispensing. For example, doctors will check for the symptoms and do some tests before coming up with any diseases, and the diagnosis will be made based on the symptoms suffered by the patient as well as the results of the test conducted. As for pharmacies, they need to check for the ingredient of the drug and confirm with the patient on any allergy before approving and dispensing medication. These scenarios clearly indicates that the skills learned from critical thinking subjects is well used in our working environment.
Everyone experiences problems from time to time. Some of our problems are big and complicated, while others may be more easily solved. There is no shortage of challenges and issues that can arise on the study. Having the necessary skills to identify solutions to problems is one of the skills that students should look for in. Problem-solving ethical thinking refers to the ability to use knowledge, facts, and data to effectively solve problems. This doesn't mean that they need to have an immediate answer, but it means they have to be able to think on their feet, assess problems, and find solutions. The ability to develop a well-thought-out solution within a reasonable time frame is identify better alternative options for diagnosis and treatments. They'll be able to find the best solution for the patient as a whole, which may be different to generate advice specific to the disease. This will help the students to avoid medical and clinical errors during their studies and future medical career. With critical thinking skills, the healthcare students will be able to reflect critically on their learning experiences and working processes. Based on their reflection, they can make effective decisions. While solving problems, students also learn other important skills such as creativity, collaboration, and cooperation. These are essential skills for students working on assignments or conducting research. Their ability to actively use reason to analyze issues, make decisions, and ultimately overcome problems. Furthermore, thinking critically and creatively will help healthcare students not only with academic work but also in everyday work and activities. For example, they will be able to solve problems with critical thinking skills regarding time management by making a schedule that can balance between their work and relaxed time. Therefore, problem solving is the result of critical thinking. It involves discovering and analyzing the problem with the goal of finding the best possible solution to overcome the obstacle. That's all from me. Thank you. Okay, I will continue with my next point, which is critical thinking facilitate self-reflective. Critical and reflective thinking encompasses a set of abilities that students use to examine their own thinking and that of others. This involves making judgments based on reasoning, where students consider options, analyze options using specific criteria, and draw conclusions. Students who think critically and reflectively are analytical and investigative, willing to question and challenge their own thoughts, ideas, and assumptions and challenge those of others. A critical thinker uses their ideas, experiences, and reflections to set goals, make judgments, and refine their thinking. Critical reflection is an extension of critical thinking. It asks healthcare students to think about their practice and ideas, and then it challenges them to step back and examine their thinking by asking probing questions. It asks them to not only delve into the past and look at the present, but importantly, it asks them to speculate about the future and act. Critical thinkers have the inherent ability to see changes from the several perspectives. By deflecting the reaction to defend their personal beliefs, critical thinkers are more self-reflective and can change their minds and opinions in light of new information. All in all, critical thinking is crucial for self-reflection. In order to live a meaningful life and to structure our lives accordingly, we need to justify and reflect on our values and decisions. Critical thinking provides the tools for this process of self-evaluation. That's all from me. Thank you.
My name is Perharaasan, and I agree with the notion that critical thinking subject should be mandatory for all healthcare students. This is because critical thinking is able to improve the quality of communication among healthcare workers in the future. This is because when a healthcare worker who is able to think critically, they are able to communicate easily by preparing information, arguments, point of views, and possible solutions. Therefore, they are able to convey their message clearly and have the most possible impact of the said conversation. In other words, they are able to convey their message without any doubts. A healthcare worker who is a critical thinker is able to stay on their point throughout the entire conversation. Without the deviation of topic, a more dynamic discussion is able to take place, especially when presenting cases or during debrief sessions. The mastery of nonverbal cues by healthcare workers who possess critical thinking skills, such as the right bodily gestures and sufficient eye contact, are able to make the patients feel more comfortable and feel at ease when receiving their diagnoses and prescriptions from healthcare workers. At the same time, healthcare workers who are able to think critically are able to manage their emotions during communication. Therefore, they are able to remain calm and collected even during a heated argument, which in turn lead to an argument to a discussion without any conflicts. So it is very clear that critical thinking is able to improve the quality of communication and make communication far more effective among healthcare workers. In conclusion, critical thinking as a subject should be mandatory for future healthcare workers because it is able to create a workspace in the hospital that stimulates and actively encourages the diversity of opinion and ideas. Through this, healthcare workers are able to understand and empathize with their patients more deeply. And at the same time, healthcare workers are able to share their opinions without any doubt. It also improves team working skills, which leads to the best possible care for patients in need while improving themselves for a brighter future of the healthcare world. Thank you.